This is an ECG taken during one of our screening programs. This ECG was taken from an asymptomatic individual who was an excellent runner and had never experienced palpitation, dizziness or blackouts. But this is a very abnormal ECG which shows marked prolongation of the QT interval. Indeed, the QT interval here exceeds 500 milliseconds, suggesting that this individual could be at increased risk of sudden death. Current literature suggests that athletes have slow heart rates, and by virtue of their slow heart rates may have long QT intervals. Our experience suggests that in an athlete, a QT interval of more than 500 milliseconds always indicates disease rather than just a physiological process. All athletes with QT intervals more than 500 milliseconds and all athletes with QT intervals between 440 and 500 milliseconds who have symptoms or a family history of long QT syndrome should be evaluated at an expert center, be initiated on a beta blocker, and be considered for an ICD should they ever experience unheralded blackouts or fatal ventricular disturbances.